Welcome to UNCUT. I'm Steve Adubato. We are honored to be joined by Fatimah Loren Dreier, Executive Director, the Health Alliance for Violence Prevention. Good to see you, Fatimah.
Wonderful to meet you. Thank you.
We should say that as we're taping this UNCUT, you were just married 2 weeks ago, correct?
Yes, I was. Yes.
All right. Well, congratulations, most importantly.
I
appreciate
that.
We're doing a program. Sorry, there's always a little delay. Sorry about that. Last time we saw each other was in the studio, and the next time we'll be in the studio. We hope and pray. Fatimah, let's talk about the Health Alliance for Violence Prevention. What is it, and why does it matter now more than ever?
Absolutely. So the Health Alliance for Violence Intervention, we call the HAVI, is a national network of hospital-based violence intervention programs. We have 40 members throughout the country and in other countries as well that really push for programs that support violently injured patients who are largely boys and men of color, who unfortunately are caught in the revolving cycle of violence. Our programs effectively support violently injured patients, ensure that they do not become re-injured and are on paths to thriving and healing in their communities. We do so in a cost-effective way, and our model is growing. So we have about, in addition to our 40 members, we have about 30 emerging programs throughout the country. So our model's growing in roughly 70 cities.
What does it mean, Fatimah, to quote, heal communities impacted by violence? What does that mean?
So if we think about violence, when people kind of think about what violence is, they associate it with interpersonal violence. Community violence is often what it's called. Intentional personal harm that involves a gun. It might involve a knife or a blunt force. We take a broad view that violence occurs in many different ways and is the function of a society that has divested in communities. So if you think about, it's not that people wake up and take up arms, but it is often the product of structural racism. It is the product of intergenerational harm over time. And because of those conditions, you don't have employment opportunities, housing, supports, trauma care. Because those resources aren't available, then we see an increase in community violence. So when we say heal communities, we are talking about encouraging and supporting structural change. We want to see greater housing, transportation, employment for communities, and then alongside that support individuals who are at greatest risk having access to those resources directly. And we do so by hiring violence intervention specialists. These are people from the community who are hired, who have lived experience, have often themselves been impacted by violence. They are the ones that are the really on the front lines providing the healing. So people are receiving care and support from people that they know, that they're familiar with, who are from their neighborhoods, and help them navigate these resources to ensure that they get the full care that they deserve.
So a conversation that we're continuing to have, simply called Confronting Racism, all right? A series of conversations, programs, forums, etc. The connection between racism and violence is?
Let's talk about the history of our country. We are a country that was built on an aggressive, violent institution of slavery. And that institution lasted for hundreds of years and impacted millions of people. And following slavery, there was the promulgation of laws, customs, a culture of racialized terror, lynchings. There were new laws that were enacted to ensure that the growth of mass incarceration that really has resulted in present day terms a level of impact that we are just beginning to understand. This impact, this structural impact, is then coupled with the interpersonal racism that people also see. You read about, for example, Ta-Nehisi Coates wrote in The Atlantic about redlining and housing policies that help shape our current cities. This is what we mean when we say racism. This, again, on top of people's views, their understanding. In healthcare, we see there are studies that look at health professionals' belief in the ways in which Black people experience pain, those sorts of things that actually impact care, the quality of care and the kinds of care that people receive. It is rampant. So let's talk about that. That is a big word, social determinants of health. Let's break it down. What does it mean? So we want people to be healthy. Health saves the country money. It saves us. It ensures that people are thriving, are productive, are living self-actualized lives. That's what health is. And there are a number of things that contribute to that, that are the responsibility of society. Housing is a social determinant of health. If I don't have housing, it is hard to expect me to be fully self-actualized and healthy in my life. Employment is a social determinant. It helps determine the well-being of communities. And so we've coined this phrase, social determinants of health, as a short change for it is a summary, it's a way of describing things that we believe at its foundation ensure that communities thrive and require investment, not just because it's a handout, but because it's the right thing to do to ensure that people are healthy.
You know, last question I have on this end is, and I've asked every leader who has joined us as part of this Confronting Racism initiative, why is it so important that we talk honestly, even when it's really uncomfortable for many of us to talk about and confront racism? Why is it so critical for our state and nation?
There has been a profound silence in our nation about the impact of racism, and on an everyday level and on a structural level. That alone, the silence, well, I'm a good person and you're a good person, and so therefore we don't have to talk about things that are unpleasant. That mentality has done tremendous harm, because there have been, for many, many, many years, people who've been crying out for help, for support, who their police brutality did not just start, it has been a prevailing experience for communities for a long time. To talk and to be open, to have conversations about racism, is to see people in their humanity. It is to acknowledge harm that has been done, and it begins a conversation about repair and about investment. And oftentimes, when we have harm that happens in society, it needs to be repaired. And not only does it need to be repaired, but we need to have a narrative or an understanding in our minds of where we're going. And where we're going is a society that can say to itself, we did right by the people we harmed. We took an opportunity to speak and not remain silent in order to ensure that people and their well-being, their children's well-being, the families, the communities that are impacted are heard, and that there is a response commensurate to that pain. In doing so, we maintain the values of our society, the values of love, care, and compassion, which I believe actually most people believe in. They operate through in their own communities. We can extend that to all people. And I think that opportunity is upon us. So I encourage people to be brave and courageous, naming harm, doing your own research, read. There a number of really powerful books that talk about the legacy of racism and white supremacy that are important for us to understand, and to discuss, share what you know, engage in challenging conversations, support others in learning, because I think we as a country have an opportunity to move forward together.
You've just helped us. Fatima, thank you so much for joining us, sharing, and teaching us as well. All the best to you.
Thank you. I appreciate that.
I'm Steve Adubato. This has been UNCUT.